Welcome to Global Minds, Harvard Alumni for Global Development's podcast. I'm your host, Michele Kawamoto Perry. On this show, we speak with global development professionals from all walks of life, people working to make the world healthier, more equitable, and more hopeful. Today's guest is someone whose work sits at the heart of bodily autonomy, women's empowerment, and global health at scale. We're joined by Aparajita Ramakrishnan, director of the family planning team at the Gates Foundation. She spent more than 2 decades working across HIV prevention, health systems, donor partnerships, and reproductive health. And today she leads one of the most influential global family planning portfolios in the world. Aparajita, welcome to Global Minds.
Thank you very much, Michele. Great to be here.
Now, Aparajita, you've had an incredible journey from Harvard to McKinsey to global health, and now leading the family planning team at the Gates Foundation. Can you share the story of how you entered this field? What drew you to reproductive health and global development?
Thanks, Michele. It's a great question, and it's a great opportunity to look back on what I realize now has been a long career in global development and global health, but didn't start out that way. So I didn't start my career thinking, I'm going to work in family planning. I did think, however, at the very beginning of my career, i.e., at the end of university, at my last few years, about what did I really want for my future? What was my plan? And I did want to work in development. I knew that at very long ago. But I remember at that time I had a professor, Professor Peter Timmer, who at the time was an agriculture professor at the Kennedy School, and he gave me some advice. He said, you know what, the field of development has a lot of PhDs. It has a lot of people who have health expertise. It needs more management and professional expertise. And he actually set me off on a path where I started out in business. And I decided to pursue sort of the field of business to build my managerial and professional development toolkit in that space in order to hopefully in the future apply it to development. So funnily enough, right after university, of course, I started out work at Disney, and then I was at McKinsey. I went to business school in between, and then I was always committed to going back into development. And I had this amazing opportunity at the time when I was at McKinsey, and I had this call from Ashok Alexander. He was sitting in the India office of McKinsey, and he was about to start up this whole new initiative for the Gates Foundation. And I remember him saying, what do you think? Like, are you willing to make the leap? And I would have had to have left New York, moved back to India, and then I did join that team. I was one of 6 ex-McKinsey consultants who started that program in India. And then since then, that program has evolved into one of the largest programs for the Gates Foundation in India, doing much more than HIV, which is what I was originally recruited to work on. So my career started with business, but with very much the intention of moving to development, and has since stayed in the area of development, which I absolutely love doing. So I actually then, since the work I started with HIV, moved from HIV to health systems and self-help groups and empowering women and girls through economic empowerment, and also working on maternal mortality in a very large state in India. And then finally moved to London, actually, to seek an opportunity within the foundation to do other work around donor partnerships, a whole new world of opportunity and scale. And I did then most recently join this family planning team and have the enormous privilege of leading what is one of the most significant investments in reproductive health globally with the Gates Foundation, working amidst just a sea of competent and incredibly committed partners. Reproductive health for me is something that happened almost as a consequence of all the other things I've done in my field. And so it has really been one of the most incredible journeys since I actually left university. And, the principles that I learned all along the way seem to be the things that I'm actually utilizing on this job. So really, really enjoying it. And, the fact that family planning is such a transformative area, and we'll come to that later, is just, it's just one of the most incredible opportunities that I have.
Well, speaking of what you learned along the way, looking back at your early years in India working on HIV prevention, what experiences shaped your understanding of health inequities?
Yeah, I mean, working on HIV prevention in India at the very beginning of the epidemic in India in 2003, it was all new. It was new to me, it was new to our team, it was new to the foundation at that time working in India. So really what we were doing was applying classic business principles in a way to scaling a development health program. And frankly, I would say it worked. The areas that we actually needed to focus on, we managed to. So Avahan, which was the HIV program we started with the Gates Foundation in India in 2003, had one goal. It was to stem the tide of HIV, which was at that time projected to engulf India. Models turned out to be, thankfully, somewhat incorrect, but the problem was still large and severe. And we had to work with marginalized populations like sex workers, men who had sex with men, injecting drug users, transgenders. So obviously, these are groups that were deeply stigmatized, not just with HIV in association with that, but just generally. So the true lesson was one that stuck with me wherever I go in development and continues to drive the way I approach the work. I think it's about leverage points and listening. And so in this case, the rate limiter in HIV, it turned out, wasn't that people didn't know about condoms or they didn't know that they worked to prevent infection, the spread of infection, but rather that their daily problem of these communities was violence. So if we are trying to solve or address a development problem, and you start with where we are instead of starting with where the people who face the problem, where they are, you are bound to fail. So we realized that the initial issue, whether it was the pimps or the police or even what they call gundas or ruffians on the street, these sex workers were constantly subject to violence. And so unless we helped address that issue initially, we didn't have, in a way, the space or the right to talk to them about something like HIV, which might kill them in several years to come. So we then built what at that time, a very large violence reduction program run by partners from the NGOs and owned by the community, and then was scaled nationally. And we then transitioned that program to the government of India. So there were lots of lessons about scale, listening to the customer, focusing on the rate limiting factors, and really, really focusing on data for decision making. These are all things that you also do in good business and happen to be things that we were able to apply successfully to the HIV program, which was then documented to have saved over 600,000 lives.
Well, that's a very significant impact that you had on India, and what incredible work you were able to do. And now shifting over to the Gates Foundation, the foundation's commitment to family planning took shape in 2012 during the London summit, when contraceptive access was elevated as a major global equity issue. Can you walk us through the history of this work within the foundation?
The London summit really changed what was politically possible. This was in 2012. There was a huge mobilization. It was called the Family Planning Summit. Family planning, you'll hear me use that word interchangeably. It essentially is access to contraceptives in the sector. That's what it's called, family planning. But it is really the access to contraceptives program. It's another way to think about it. This Family Planning Summit that happened in 2012 it took an issue that leaders were once very hesitant to even name, and it made it something they could not just stand behind, but really rally behind. Things that it addressed, issues like health, education, and economic progress all the way through family planning. So I think once that shift happened in 2012, a lot of action followed. Governments, donors, partners aligned in a way that we hadn't seen before. I think over $2.5 billion was mobilized, and over 100 million additional women were to gain access to contraception than compared to 2012. Today, there are 100 million more women who have access to contraceptives. But the real shift was much deeper than the numbers. I think that summit, in a way, changed the conversation about whether a family plan matters to exactly how well we deliver it and how well we're able to reach those who most need it. And have we done enough? And is it sufficient? And this real choice with real quality and systems that actually reach women, is that system in place right now? And I think we think about it, there's a lot of focus on rights. And in this case, these are crucial. But these rights are real when they're realized through action. And I think that's what we are hoping to really see in the future, having come this far. And it doesn't get said enough, but family planning or contraceptive access, it's not only one of development's biggest success stories, but it's one of the most cost-effective interventions that are available to us in health and in development. It's pretty incredible if you think about it. So contraceptive access and reductions in fertility are responsible for 39% of the drop in maternal deaths since 2000, because it reduces the highest risk pregnancies with teenagers, and also unspaced pregnancies, and also those that are not planned. And this is what I always say, as someone who's had as a business background and has moved through that space, if you will, that every dollar spent on contraception stimulates over $26 of socioeconomic benefits. I mean, as anyone working in investment or in any kind of investment bank, a 26x return is a multiplier anyone should care about. Every finance minister, every health minister, this $26 happens because it's such an upstream intervention. When an unintended pregnancy, a woman is given the choice. Girls finish education. They can choose to work. They can decide if and when and how many children to have. There's huge savings in actually health costs from the government, from fewer complications during deliveries. Women are able to have their children and they be healthier parents to them. The reductions in stunting because of the impact of spacing. So leaders today should be building on the success and are building on the success. And I think that should be the case. There shouldn't be an undermining of this effort, but rather an amplification of focus on what is one of the most compelling investment cases we have in development today.
And you stepped into this role of director of family planning team in 2023. Could you describe your mandate and the core areas that your team leads today?
Yeah, thanks. So it's first of all been a privilege and an honor to work in this space. As a mother of a teenage daughter, I can only say that this is an area and a space that means a lot to me personally. Ensuring girls and women have choice, and a choice of when they want to be pregnant or not, with whom, how many children they have, and what type of life they want to live. So this is the mandate of the team as well. It turns out we have a few focus areas, strengthen supply side and delivery of programs, recognize that, sometimes the barriers to demand are at a very local level, and we need to understand what they are so that we can really address the reasons for non-use of methods of family planning. Then addressing parts of the ecosystem which really need this, which include domestic financing, overall financing for family planning, and the commodities that go with them, the commodities being the actual contraceptives. And working with the private sector, which could be a huge channel. Family planning products are often sold in the private sector: condoms, pills, emergency contraception, etc. So this is another channel that could really be leveraged. And then finally, underlining all of this with a lot of data. I mean, anyone who knows me would say I do come to this field with a great deal of data and rigor as background, because in a way it's exciting and interesting. It stimulates a very informed discussion around the subject, but also it's incredibly important because limited resources need to be deployed in the most cost efficient way that they can be. And to do that, you often need data, whether you're running a business or running a health program or a development program, or in this case, a family planning program. So this requires working with tons of colleagues across the foundation, as well as partners in the ecosystem who've just been an incredible asset to the sector and to our work. Partners working in Africa, sub-Saharan Africa, in Asia, as well as our donor partners and those working in high-income countries who are fellow travelers in this journey. So there are a bunch of things that we do, all the way from product innovation to health system strengthening to gender equality to partnerships with governments and communities, making this one of the most exciting portfolios.
The foundation supports near term impact in 6 countries while also advancing global scale. What does this portfolio look like in practice?
Yeah, I think if we think about it, that is the sort of it's a two-track set of work, at least we are working on at the foundation. I mean, first of all, our work in family planning spans, upstream R&D and innovation, and it spans downstream delivery and product introduction. So I think there's a pretty wide range of, first of all, scope. But in terms of our delivery work in country, we have 6 countries in which we are intensively working with our partners, with the government partners and others, including in places where we have a foundation presence. And we're very intentional about working on those two levels, in those in countries and at the global level. So in these handful of countries, I can name them: Senegal, Cote d'Ivoire, Nigeria, Ethiopia, Niger, and Pakistan. And within Nigeria and Pakistan, within sub-geographies, we're not working at the national level, just given the scale. So we're actually looking to see how can we make real impact on family planning outcomes, measure those, and have them be archetypes that can be replicated and scaled elsewhere, while in parallel investing in globally in innovation, products, delivery systems, data that lift the entire field. So the goal is not just progress in a few places, the goal is progress everywhere. But because advances of like in women's health are ultimately going to benefit women in all contexts, frankly, low, middle, high income countries alike. And our ambition remains very, very high to try and make as much impact at the lowest cost with as many partners to sustain this impact as humanly possible.
And as the foundation works to expand contraceptive access in low income and remote communities, what are the most significant organizational or systemic challenges you're navigating?
Yeah, the contexts in which we operate are indeed very complex, and family planning, like many other development issues, is challenging to address, and especially address at scale in a way that is responsive to local needs and contexts. I think one of the big lessons I've learned is that access, it's not ever just about supply, of course, but without the supply, nothing else works. There's a famous saying in this community of family planning: no product, no program. And I think that it's something I learned since I was new to this sector. And it's very interesting because the product being the actual contraceptive. So you have lots of demand generation. You have people drumming up interest, these women coming from very far regions to a facility, and then there's no product there, or the product that they need is not at the chemist shop that they want to buy it at. So that product availability is at the essence or the core of the program, but it is obviously necessary but not sufficient. So that supply piece is critical. And because women's health is often just not prioritized by the stakeholders relevant, I would say it's a particularly stark core problem to address. But of course, in terms of that shortage, we see over $270 million procurement gap globally for products, and that means there are you could estimate it at very many tens of millions of women who don't have access to products today, and that's something that's limiting their choice. And so addressing this is really, really critical. And it is, as I mentioned, such a cost effective investment to make. The truth is that, women can't choose what's not there. So I think ensuring product that is available is super important. And we've made investments like in the UNFPA, which is the UN Organization for Family Planning for Population, and its supplies division is such a critical partner for us in actually in aggregating demand and actually delivering product to countries. So that's a critical piece of our work. That's a challenge that we have addressed or are addressing. But of course, we are one of many partners who are in the space. And on the other side, you think of supply and then you think of demand. Here, there's so many things that drive non-use of family planning. And we've actually done some very cool machine learning-led analytics around this in the countries in which we're operating, I mentioned to you, to look at what are the causal drivers of non-use. And one of the things that obviously emerges is when women express an intent to use family planning, they're generally more likely to use family planning. So developing that intent often is inhibited in turn by many structural things. One of the bigger ones that we've noticed that has emerged from the data, obviously, is the role of their partner, the men and the boys in their lives, and the norms that come with that. And how do we actually unlock that potential through demand interventions? It's another area we're looking at. That's another challenging area, but one where focus can drive greater efficiency. And we've, tried to make some bets in that space that we hope will prove out that focus can actually move the needle on removing structural barriers to demand and intent. So those are two big ones: supply and demand.
You mentioned that you have to work with different partners and stakeholders. How does your team collaborate with ministries of health, implementing partners, and donors to strengthen systems and expand access? And what challenges arise in aligning multiple stakeholders toward the same goals?
Yeah, I mean, it's a really good question because ultimately, we also believe in walking through open doors. Contraception and its importance, it has to be a local priority in order for the actions to yield results. So, where there is strong political and bureaucratic will to engage on this, and with it by the countries, the governments, the communities who are keen to work on this, that's where we feel we can be catalysts for change as an external foundation. And so I think if you think about that, I mean, what we then need to do is really rely on very strong partnerships with the government, communities, advocates, because you can't solve such an issue in a silo. Progress really does depend on partnerships and fellow travelers, whether those are governments, other donors, community groups, implementing partners, technical agents. And so there are many, many different kinds of partners, but the government obviously is a very key counterparty. And how we embed ourselves within their agenda and try really to be as led by the country agenda as possible is the work. It's complex work, and that's why we have teams that are spread out everywhere we work. But it is a key challenge that we feel we must address in order to be catalytic and also effective.
Well, Aparajita, can you share a success story where improved contraceptive access has meaningfully transformed outcomes for women in communities?
Yeah, I'll give you an academic answer and then a bit of a story. I think you only have to read Claudia Golden's Career and Family to understand how transformative access to contraceptive is. I don't know if the viewers and readers of this will know, but Claudia Golden is the first woman to win solo a Nobel Prize in economics very recently for her work called Career and Family, where she actually describes women's labor force participation and what really transformed over the course of the 60s in the US. And one of the pieces she identifies as really, really critical is the advent of the pill in the 1960s, which has enabled women to choose career and family instead of career or family. So if you think of transforming societies and nations, you can't call it a silver bullet, but it comes damn close. Contraceptives is literally, it can be life saving. And so this is a success story if you think about how it's characterized by Golden in her book. And I think the analysis she's done to show how the impacts of contraception on female labor force participation, and you can extrapolate that to other countries. The effects are likely to be seen everywhere. So this is a transformative program, if you will. I mean, taking it to the a more of a story, when I was in Ethiopia a couple of years ago, I remember we were at a program that was addressing adolescents. And adolescents, I mean, they were really young girls. And the program was to provide them with access to contraceptives. They were married adolescents in Ethiopia. The program is called Adolescent 360. And, there were a bunch of girls kind of sitting on the side, and they were all of them kind of, they looked between, I would say, 13 and 16 or so, maybe some 17. And each of them with a child under one, under their arm. And I had a chance to interact with them. And I had a chance to ask them a lot about themselves. And then I asked them, as a part of that, how do you feel about having gotten pregnant? Did you intend the pregnancy? And they all said no. They didn't intend the pregnancy, but I think there were other structural things at work. And of course, they looked lovingly at their children. They adored their children. But then I asked them, what would you have done with if you had not gotten pregnant? And many of them talked about, one of them talked about wanting to have a shop. And then the other one talked about wanting to stay in school. And so, I mean, this just struck me. I mean, luckily, they also now were at the program and able to access contraceptives to delay the second pregnancy. And this is incredibly important. Obviously, when you start the first pregnancy also matters, and it's so structural and difficult to address. And in this context, really young girls. And then in the context of, spacing, this is going to open up opportunities. Several of them said they want to go back to school. So they're going to go back to school. And this just says like the entire trajectory of a girl's life is transformed through access to something that is core, that is her right, and that we as a community, I think, are somehow on the hook for to ensure she gets. So that's why we do what we do.
And when you visit programs in the field like you did in Ethiopia, what experiences really stay with you?
I think the interactions with the communities of those who really need these services is always most inspiring for me. I often do this thing where I sit at the back rather than, they usually see the donors in the front. This I don't know if you've done field trips of this kind, but it's much more fun because girls gossip. They talk much more when you're sitting right next to them. And I find this engagement with the community is what really inspires me to do what I do. It's why I love going to the field. But of course, then there's very important work to be done with the government. So I also love actually spending time being inspired by and hopefully inspiring government officials and leaders to take an interest in this subject and also build on their own existing interest and try to be as helpful as we can be as external catalysts. So these are two very fun things about the work itself.
And looking at the long term, what are the key risks or considerations to ensure that programs remain viable as philanthropic funding winds down?
Yeah. I mean, this is what we're seized with right now. There's obviously a need to massively ratchet up the dedication of resources to enable impact on what we call modern contraceptive prevalence, MCPR, the modern contraceptive prevalence rate. And I think that is a huge effort in and of itself. But then this sector has traditionally been very donor dependent. There's been a huge amount of funding from donors, which is then on the flip side of that, the government funding has not been as significant. So I think this future that we are talking about now, while we're trying to increase impact, has to also be more locally led and less donor dependent. And so these recent aid cuts prove that we have to have domestic demand and the funding domestically as the backbone of delivery, with donors playing a catalytic role, not the other way around. So one of the focus areas for us going forward is how do we reduce the cost needed to actually do these interventions? Actually, that's a big focus for us so that then every dollar that is needed can go further. And then also think of how do we plant the program ideas and intelligence in such a way that they are absorbed by the right natural owners, whether those are the private sector, whether they are governments themselves, communities. So, how do we take the future of family planning as a goal for self sustenance? And that is really an important part of our strategy, which is we are laser focused on, at least over the next 10 years, trying to achieve with partners in the government, partners like the World Bank, and many others. So I think this is going to be a key focus area for us to go further. And we think that we can do this by reducing costs per person reached to make the money go further, to increase the ability of to access contraceptives through the private sector. For those who can afford it, can pharmacies be the source of their products? Enabling then the subsidized resources to reach those who are most vulnerable and cannot afford to self finance access to these products and services, then also to increase domestic ownership and funding. So governments see the value and being able to shift the weight, if you will, of bearing this from donors to the natural owners in this, which in this case, lower middle income country governments. And then increasing the number of total women who are accessing contraceptives, because in the end, they become the best ambassadors of the benefits of contraception, spreading the word and demanding continued access. But obviously, we can't do this alone. So we need fellow travelers. And this is a huge opportunity for others to invest in family planning now, either as a one-off investment or as something that can be sustained over the coming decades.
Well, for listeners who care deeply about gender equity and bodily autonomy, how can they best support this work professionally, financially, or even in their own communities?
Well, we need help. The sector needs help. We see a lot of retreat by large funders and donors. So the need of the hour is to fill that, at least to start with, 270 million annual gap, because that's people who need services and products right now who just don't have it. So there's a financial need. And we're developing instruments to actually be able to receive that resource directly from people or from companies or from individual investors or philanthropists. So financing is really crucial because that's where this entire issue of access to contraception comes to life. So that would be my first pitch. And I wouldn't be doing justice to all these girls and women if I didn't make that the first pitch. But there are so many other ways that one can participate in this. It's a dialogue at the end of the day. One can place one's voice, one can volunteer, one can actually show that this issue matters, one can work with one's local communities to kind of raise awareness, and one can volunteer in countries as well. So there's a voice and a salience that actually can be enhanced by anyone listening to this podcast. But of course, financial contributions also matter a lot.
And in closing out today's really extraordinary conversation, what gives you the most optimism about the future of reproductive health?
Yeah, this one's an easy one because I think about it every day. And it's what gives me joy in this work. It's ultimately the girls and women whom actually are both the beneficiaries of and in need of these programs. They give me a lot of optimism because this belief that I have in the fact that when you empower a girl or a woman to make a choice, she makes the right choice for herself, for the community, for the entire system in which she operates. And I think that this little more access, little more agency, they can use it in extraordinary ways. And the challenge isn't really will women act, it's whether the systems, in a way, will meet them and support them in a way that they deserve. When they have access and agency, they just don't just change their own lives, they change the world. I mean, and I don't mean to say this in a grandiose way, but that's literally the powerful action that access to contraceptives provides. So I think it's really the optimism is the girls and the women themselves.
Well, Aparajita, thank you so much for joining us and for sharing your insights and your passion. Your work is a reminder that access to family planning is not just a health issue, it's a matter of dignity, autonomy, and opportunity for millions of women around the world.
Absolutely. Thanks, Michelle.
And to our listeners, thank you for joining us on Global Minds, the Harvard Alumni for Global Development podcast. I'm Michele Kawamoto Perry. If you enjoyed this episode, please subscribe, share, and stay tuned for more conversations with leaders shaping a more equitable world.